incisal and occlusal thirds. Now, if you see the incisal and occlusal thirds of our teeth, they are not flat. Okay? Usually they have some elevations and depressions. Elevations are usually the cusp and the marginal regions. Depressions are usually the fissures and bits and fissures associated. Okay? Now, usually when one teeth occludes with the opposing tooth, one curved surface occludes with the another curved surface. One curved surface occludes with the another curved surface. Most commonly followed principle is the cusp getting engaged in the fossa of the opposing tooth, or cusp getting engaged in the marginal ridge of the opposing tooth. Okay. Now we always think that this particular occlusion is very perfect, means there is no space whenever, for example, when a cusp is occluding in the fossa of the opposing teeth, we think that it completely it snugly fits within it, but it is not like that. If you see that even in one particular view, you can, if you are seeing it from one particular direction, you can think that it is snugly fitting. But if it's the same fit, if you see from the opposing direction, you will see that there are many spaces, and these spaces are very important. These spaces are called as escape ways. Now there are a variety of other grooves and sulci or depressions are present on our tooth surfaces. They are very important. Why? Because they are actually the escape ways. Now what are these escape ways? Whenever you bite, whenever there is a food between our upper and lower teeth, we exert almost 250 kilograms per square inch pressure. Now just imagine if you are biting, once the food has got beaten into a sufficient smaller size, it should move out of that area. But if the tooth is upward, one tooth is getting fixed into the other very snugly, there won't be any space. So that food will remain on the tooth. So that unnecessarily one of the tooth will be subjected to more prolonged exposure to a higher amount of forces, because the food is not getting any escape away from the tooth surface. So for this, these grooves are very important. Okay? I told you that there are, as I told you that we think that this particular teeth, they snugly fit with each other. Now see in this particular view, it appears as if there is no space. But just move that tooth. If you are viewing it from slightly mesial aspect, you will notice that there are spaces in the occlusion points. Okay? These spaces are very important because they act as the escape ways. Okay? Similar thing, they behave similarly to what we call as embracures. Now the next point is the facial and lingual relationship of each teeth in one arch to its antagonist in the opposing arch. Now this is similar to that of the primary dentition, that normally one tooth occludes with the two opposing teeth in the opposing arch. Only few exceptions are the lower central incisors being smaller in size, and the maxillary third molars being the last tooth into the arches. Okay. Now the permanency of our arch and is totally dependent upon the mutual support between the teeth. If the teeth are not in tight contact with each other, this is particularly important for the permanent dentition. In deciduous dentition, usually there are no tight contacts, but in case of the permanent dentition, the tight contacts are very much required. If there are no tight contacts, the teeth won't be surviving longer. Either they will destroy themselves, or they will get fractured, or they will destroy their supporting apparatus. So this is how the tooth occlude with each other. Okay, you can see the relationship of the tooth. One tooth is usually occluding with the two other teeth in the opposing arches. Now, what are the applied aspects related to this relation? Now, for example, as shown in this particular schematic diagram, if the first molar is lost, what will happen? Now, all our teeth, they keep on moving mesially. This mesial movement is guided by many different factors like the anteriorly directed force or the transeptal ligament. But now, for example, coming back to this point, now if the first molar is lost, what will happen? The second molar would start tipping in that space. Now, when the second molar is tipping, what it is doing? the distal part of the second molar will start impinging on the upper second molar. So you will get an occlusal facet in that. So in just loss of one teeth is going to alter the occlusion entirely in that arch. As this is taping mesially, see this third molar. It will come out of contact with the opposite third molar. There would be space between that, so that the person won't be able to chew from that side properly. Okay, so these interrelationships are very important. Okay. Now, occlusal contacts and intercuspal relationship in centric occlusion. Now I will describe some few terms like the centric stops or supporting cusp. Now, centric stops are those contact areas between the opposing teeth in central occlusion, which are very important. As I told you, there are around 138 centric stops, which are important for making the occlusion stable. Okay. Supporting cusp, these are the cusps of teeth that contact the centric stops on the opposing teeth. For example, the mesolingual cusp of the maxillary first molar contacts the central fossa of the mandibular molar. Okay. This is the what we call as this black spots would be the centric stops. Okay. This is where actually the maximum point of contact is occurring between the opposing teeth. Okay. So you can see that here it is occluding directly into the fossa. Here it is occluding on the marginal regions. So in this way there are around 138 different stops. Now, there is another important term which was asked some years back: stamp cusp and shearing cusp. Stamp cusp is nothing but the centric holding cusp, or in short, the cusp which is getting occluded in the central fossa of an opposing tooth. So that is called as the stamping cusp. Usually, in a tooth, the stamp cusp will constitute 60% of the part. Okay? The shear cusp is the opposing to the stamp cusp in the same root. What is the function of the shear cusp? As the name is suggesting, it is shearing. Shearing means it is breaking down the food into the small particles. Shearing cusp would usually involve the 40% of the entire tooth size. Now, so all this supporting cusp, shearing cusp, they interact with each other. As I told you, the one teeth will interact with two of the opposing tooth. So in this way, 138 possible occlusal contacts, 138 contacts are possible. Okay. These contacts are very important. For example, because without this contact, proper functioning mastication won't be happen. The occlusal load won't be distributed aesthetically equally everywhere. Aesthetically, it won't be pleasing. Plus, the soft tissue, if the occlusal contacts are not proper, the soft tissue will get impinged by the teeth. Now, next point is the occlusal contacts and intercuspal relationship during the various mandibular movements. Now, there are many variety of movements are possible by the mandible because it is quite freely movable. But most important are these three movements, that is the lateral, protrusive and retrusive movement. Okay. Now what is this? In lateral movement, what happens first is the jaw will depress, then the mandible will either move to the right or the left side. If it moves to the right side, then the right side will be called as the working side, whereas the opposite side, that is the left side, will be called as balancing or non-working side. The lateral movement can further be divided into two types, that is canine guided occlusion or group function occlusion. Now don't get confused in between this, that these terms are just more of a clinical, but why I am explaining them because this particular part definitely comes under the factors affecting occlusion. So I have just included a small part of it. So canine guided occlusion or mutually protected occlusion, this is usually seen in younger individuals when the teeth are having very prominent cusp and ridges. Okay, when there is no accretion is seen at that time. Okay, it is characterized by that when the maxillary and mandibular canine contact with each other, there won't be any contact in the posterior teeth. That is, there would be the disclusion or no contact in the posterior teeth. Now, the group function occlusion is exactly opposite of that. It is seen in the older people when the teeth have become flatter, the cusp have become flatter. In this particular occlusion, what happens? Even when the canine, when the upper and lower canine will interact with each other, all the posterior teeth will stay connected with each other. They will be in contact with each other. Why? Because the cusp have been lost. So now they have almost become flat. So that is called what we call as group function occlusion. So this is again the same interaction of the one tooth with the opposing arch. You can see that this is what happens on the working side, non-working side, and how it is in the centric occlusion. Okay. Protrusive movement. In the protrusive movement, this is the mandible again moves it is depressed, then it moves forward until the anterior teeth come in one alignment. That is the incisal edge of the upper anteriors is contacting with the incisal edge of the lower incisors. This will result in again the posterior disclusion, that is called as incisal guidance. Then lastly, the retrusive movement. In this movement, the mandible will be moving posteriorly so that the condyles are placed in their most posterior position. The teeth, they lose their centric relation, but still they will be in contact with each other. So last part is the neurobehavioural control of the occlusion. As we know that we saw that there are so many different factors which are there in this occlusion, like muscles of mastication are there, the TM joints are there, teeth and their supporting apparatus are there. All of them have the sensory complex, nerves are there. So why they are there? Because the this particular control of occlusion is very intricate. Just imagine, for example, if you are eating anything, and while you are eating, for example, if you are eating a rice, even if a small rock or a granule comes in between, you are still able to notice it. That is because of this aspect. We can detect almost 8 micrometer foreign particle present between our tooth surfaces. Okay. How that is possible? That is possible by intricate controlled by this entire neural mechanism. There is always a synchronized masticatory movement between the teeth and the surrounding structure. That is why usually when you are eating, there won't be any tongue biting, lip biting or cheek biting normally won't occur. Because of this, various speech movements which occur, which will develop only when the mandible close are possible. Okay? And as I told you, we can detect even as small as 8 micrometer of space foreign particles between the upper and lower teeth. Then last term, which is important here, is the freeway space. Freeway space is the space between the upper and the lower teeth, which usually is approximately 2 to 3 millimeters. It is very important that it is also called as space or resting space, because if this space is not provided, the mandible teeth will be always in contact with the maxillary teeth, and that in this way the muscles of mastication will get stressed, resulting into